to everyone. Today we will read Argentum Metallicum. You can see in the picture. So आप picture में देख रहे हो, this is Argentum Metallicum. Okay, and this is also known as pure silver. And this medicine is proved by Dr. Hahnemann. Okay, you can see here mentioned. This is known as pure metallic silver, and this medicine is proved by Dr. Christian Frederick Samuel Hahnemann, and this medicine is prepared under class 7. Okay, so let's talk about the symptoms of Argentum metallicum. You can see this patient will looks like this. Okay, tall, tall, thin, irritable person. Okay, if the patient is coming to you, then he will looks very tall and thin, but that mental. If we will talk about the mentally, how the patient will be there, the mentally the irritable person will be there. Okay, but if you're talking about the tall and thin. So can anyone tell me the name of another medicine who is looking like a similar? Okay, tall, thin, कौन सा पेशेंट दिखता है? कोई बताएगा?
Phosphorus.
Yes, very good. Phosphorus. Very good. Phosphorus and और कौन पेशेंट दिखता है?
Calcaria,
What?
Calcaria carb.
Not calcaria
Calcaria carb
carb.
is for
Calcaria carb is looking like mota. Okay. मोटा फेयर फैटी फ्लेवी इफ यू आर सेइंग यदि कोई कैलकेरिया बोलता है तो इसका मतलब होता है फेयर फैटी फ्लेवी मोटा दिखेगा गोलू जैसा दिखेगा बट आई एम आस्किंग टॉल टॉल थीन ओके दुबला पतला लंबा दिखेगा ओके दैट पेशेंट इज tuberculinum okay tuberculinum so what is mentioned in tuberculinum the patient will be look tall thin but the chest will be looking narrow chest will be there and which is flat okay जो chest होगा कैसा होगा flat होगा और narrow होगा उसका ठीक है narrow एकदम ऐसे पतला होगा ठीक है and that is tuberculinum okay tuberculinum का constitution होगा okay another medicine is phosphorus okay जिसका lean thin होता है okay so this is about tall thin but if there is a only lean thin मतलब एकदम दुबला पतला होगा टॉल होगा या नहीं होगा दैट इज डजेंट मैटर बट द लीन थिन पेशेंट विल बी देयर कैचेक्टिक टाइप ऑफ पीपल विल बी देयर स्क्रॉनी दैट इज सिकल कॉर ओके सिकल कॉर ओके but another symptoms we will talk about ailments from abuse of mercury means you can see this is a mercury in the picture okay suppose if any patient is coming to you and that patient has already taken so much mercury means mercurious medicine and after that the patient has started any complaint means mercurious दवा खाया और उसके बाद कोई complaint हो गया then we will think about this medicine but these symptoms we can compare with another medicine इस symptoms को और किस medicine से compare कर सकते हैं can anyone tell और कहाँ mention है
Sir, Dalkamara.
yes
Sarsaparilla.
very good Akansha there is mention bad
Or
effect and abuse of
Oramet.
mercury and another medicine
Oramet.
yes aurum metallicum very good there is also mention and
Pipersol.
Heparsol very good Heparsol aurum mate and
Dalkamara. Sarsaparilla.
Heparsol and Dalkamara and Sarsaparilla is also there where there is mentioned frequently used after the abuse of mercury okay mercury that is mentioned in Sarsaparilla okay so these are the medicine for the bad effects of abuse of mercury okay another symptoms we will talk about constitutional effects of onanism. Why this patient is lean thin? Because the patient is doing so much onanism. A sexual excess is there, masturbation is there, and that will lead to the patient lean thin. Constitution will looks like lean thin. because the patient is having bad effects of onanism. Okay, that's why the patient will be looks like lean thin. इतना ज्यादा onanism, इतना ज्यादा sexual excess हो जाता है जिसकी वजह से क्या होता है, उसका बॉडी पतला दुबला लंबा दिखता है. ओके, लंबा तो
मतलब
होता है बट पतला दुबला हो जाता है. ओके, so just we have to remember this. Okay, another symptoms affects the cartilages, tarsal, ear, nose, eustachian, the structures entering into the joints. Means if any of these is involving, especially cartilages, or if there is a problem, especially related with the eustachian tube, then again we can think of this medicine, Argentum metallicum. Okay. Another symptom is there, seminal emission after onanism, almost every night without erection. Means most of the patient they will come to you and they will explain. So seminal emissions after onanism almost every night without erection with atrophy of penis. Means so suppose that if the patient is coming to you and that patient is having or the patient is complaining that डॉक्टर साहब मुझे रात में नाइट फॉल हो जाता है. Means there is seminal emission, loss of seminal emission almost every night, but there will be a no erection of penis. But in generally, what happened? There will be erection of penis and there will be a discharge. But in this condition, the patient will tell you, Doctor Sahib, there is no erection. The small penis is there. Atrophy of penis is there. You can see in the picture. Atrophy. Atrophy of penis. Okay, you can see in this picture. Atrophy of penis is there. And there will be a seminal discharge. But there will be a no erection. Then we can think of Argentum metallicum. But these symptoms again we can correlate with the another medicine. Means like Agnus Castus is there. So there is mentioned complete impotency is there. There is no desire for the sex. That is mentioned in Agnus Castus. Okay. And crushed pain in the testicle. Suppose if the patient is coming to you, then he will be saying, Doctor Sahab, I am having pain in my testicle. And squeezing type of pain. Miss crushed pain means what? Someone has squeezed the testis. And that type of pain will express. ऐसा लगता है पेशेंट बताएगा कि डॉक्टर साहब ऐसा लगता है किसी ने मार दिया हो या दबा दिया हो. And that type of pain the patient will express in front of you. Then we can think of this medicine. But again, these symptoms compare. Again, we can compare with the another medicine. Suppose if another patient is there, sensation as if the penis were absent. उसको लगता है कि मेरा पेनिस ही नहीं है, गायब है. So, which medicine is this? Can anyone tell? Sensation as if the penis were absent. Which medicine? Can anyone tell? Yes, very good. Cocaine. Very good, Amit and Brain. Very good. The medicine is cocaine. Okay. Another symptoms prolapses with pain in the left ovary, back and extending forward and downward, and climacteric hemorrhage is there. Okay, if the ladies patient is coming to you and that patient is saying that Dr. Sahab, I am having sensation something is coming out from the vagina. ऐसा लगता है कि vagina से कुछ निकल रहा हो, something कुछ बाहर आ रहा हो, and there is associated pain, especially in the left side of the ovary, and that will extending to the forward and downward. And there will be a climacteric hemorrhage. What is the meaning of climacteric hemorrhage? If the lady is having age more than 40 years, यदि 40 साल के बाद जो भी महिला या 40 years or 40 or 45 years के बाद अगर होता है, then that condition is known as climacteric hemorrhage. But what are the, here we can correlate with the gynae. So what are the different cause about the pain, ovarian pain? Can anyone tell? These are the different causes. Okay, like endometriosis is there, ovarian cyst is there, and ovulation pain is there, PID is there, ectopic pregnancy is there. These are the causes of pain, especially in the left ovary. Okay, at pain in the ovary. Okay, so we can think, but these symptoms again we can correlate with the another medicine. Suppose if the patient is coming to you and that patient is saying that distressing pain, especially in the left ovary, and while walking or while riding.
Puja.
Yes, very good, Amit. The medicine is thuja. Okay, so just we have to remember. But if there is a involvement of same type of symptoms, if you are finding an involvement of the right ovary is involving. So which medicine? Right ovary. Which medicine? Yes, palladium. Very good,
Palladium.
Akansha. Very good. Palladium is the medicine. Very good. Excellent. Another symptoms, total loss of voice with professional singers. Means those people who are singing a song. You can see in the picture. Professional singers. And if they are having total loss of voice, then we can think of this medicine. But these symptoms again we can correlate or compare with the another medicine. इस सिम्टम को और हम किसी दूसरे ड्रग से कोरिलेट कर सकते हैं. टोटल लॉस ऑफ वॉइस, टोटल लॉस ऑफ वॉइस while being overheated. बहुत ज्यादा अगर धूप लग गई हो या गर्म हो गया हो, गर्मी हो गई हो, so there will be a loss of voice. So can anyone tell me the name of medicine? Yes, very good, Amit. That is antimcrude. But again, these symptoms we can correlate. Like total loss of voice, we can correlate with the hoarseness. If there is a hoarseness in the morning, so which medicine? Painless hoarseness in the morning, aggravation in the morning. Which medicine? अगर कोई,
Calcarea.
yes, calcarea, and one more is there. Total loss of voice we can correlate with the another medicine. Hoarseness, which is aggravating in the morning. The medicine is calcarea, carb, and one more medicine is there, that is causticum. Okay, causticum. But causticum और calcarea carb में क्या difference होगा? Can anyone tell? दोनों में morning में होता है. But how we will differentiate? They will differentiate. Suppose if the calcarea patient is there, he will looks like fair and fatty flabby. मोटा होगा, पतला मोटा होगा, गोरा दिखेगा, एंड फैटी होगा, बहुत ज्यादा फैट होगा, एंड एसोसिएटेड विद द hoarseness, especially aggravating in the morning. But in case of causticum में कैसा होगा? hoarseness तो होगा, so hoarseness associated with the rawness feeling. ऐसा लगता है respiratory tract जो है उसका छिल गया हो. rawness feeling you will find in case of causticum. Okay, but again these symptoms we can correlate with another medicine. Hoarseness, aggravation in the evening. Which medicine?
Keeper.
Not hypersulf. There are two medicine. Yes, very good, Rima. Excellent. That is phosphorus and carbobase is there. There are two medicine. Okay. But if someone is saying hyper, so what is mentioned in hyper? There is mentioned aphonia, especially while there is cold exposure, drops of cold exposure or air. So there are two medicine. Arum triphyllum is there and hyposulf is there. Okay, so just we have to remember. Okay, but if there is a total loss of voice, then again we can correlate with the anatomy. Why there will be a hoarseness of voice, can anyone tell? एनाटॉमी से कोरिलेट करके क्या होगा, किस कंडीशन में हम लोग को ऐसा मिलेगा? हम्म, कैन एनीवन टेल? Here we can correlate with recurrent laryngeal nerve. Okay, if there will be an injury to the recurrent laryngeal nerve, so there will be a loss of voice. Okay, so just we have to remember this point. Suppose if any patient is coming to you and that patient is saying, Doctor साहब, मेरा आवाज ही नहीं निकल रहा है. I cannot speak. And there is a hoarseness of voice, which there is no clear voice. Then we can think there might be a problem which is related with the recurrent laryngeal nerve. Okay, so this is what we have correlated with the anatomy. Okay, another symptom when reading aloud has to hem and haw, cough with easy expectoration of gelatinous viscid mucus looking like a boiled starch. You can see, suppose if the patient is coming to you and that patient will explain you like that. Miss Boiled starts like you will find the expectoration. If you're finding this type of expectoration and which is gelatinous, miss sticky type of discharge will be there. Then we can think of this medicine, Argentum metallicum. Okay. Another symptoms, uterine disease with pain in the joints and limbs. Suppose if lady is coming to you and that lady is having uterine problem and associated with the joint problem, especially in the limbs, then again we can think of this medicine. But these symptoms again we can correlate with the another medicine. If if the patient is having cardiac problem, okay, cardiac problem associated with the heart problem, cardiac problem associated with the joint problem. Sorry, cardiac problem associated with the joint problem. Then can anyone tell me the name of medicine? Cardiac plus joint problem is there. Then we can think of lithium carb is the medicine. Okay. Another medicine we will read that is Argentum metallicum, and you can see in the picture this is Argentum metallicum. Okay. Just see in the picture and try to remember. Yes? Okay.
Argentum nitric.
So another medicine we will read that is Argentum nitricum. Okay. So let's talk about the who has proved. Let's talk about the prover of Argentum nitricum, and this medicine is also proved by Dr. Christian Frederick Samuel Hahnemann. And this medicine is commonly known as nitrate of silver. And this medicine is prepared under class 5th A. But if there is a question, according to GHP, Argentum nitricum medicine is prepared under which class? किस क्लास में जर्मन होम्योपैथिक फार्माकोपिया के अकॉर्डिंग इस मेडिसिन का प्रिपरेशन किस क्लास में होता है? देन आंसर विल बी क्लास 7. बट नॉर्मली अगर पूछता है कि दिस मेडिसिन इज प्रिपेयर्ड अंडर विच क्लास, देन वी कैन आंसर 5th A. Okay, so just try to remember. So let's talk about the symptoms of Argentum nitricum. Always think of Argentum nitricum seeing withered, dried up, old looking patient. Miss, this patient is looking too much old. You can see withered. Seeing withered का मतलब क्या होता है? झुर्रियां पड़ जाना. And he will looks like a too old. बुढ़ा बुढ़ा दिखेगा. And there is a emaciation which is progressing every year. Suppose this time the patient is having emaciation, especially in the legs. But in the next year, it will covering to the other parts. Like there will be emaciation in the next year. Lower limb emaciation is there, which is associated with the marasmus or emaciation of the upper limb. हर साल बढ़ता जाएगा, पहले पैर में होगा, उसके बाद हाथ में हो गया, बॉडी में हो गया. So always it will be increasing. But particularly if you want to see the emaciation, then you will find in the lower extremities of the patient. Okay, lower extremities. Okay, in the lower extremities. But if you are talking about the lower extremities marasmus, then can anyone tell me another medicine where there is mentioned marasmus of lower extremities only? Can anyone tell?
Abrotenum.
Yes, very good. Abrotenum. Okay.
Abdominal.
Very good, excellent. Abrotenum is the medicine. Okay. But this emaciation we can also correlate with the another medicine. Now we can correlate with the another medicine. There is mentioned marasmus and other wasting disease of children. So can anyone tell me the name of medicine?
Acetic acid.
Yes, very good, excellent. Very good, Akansha, very good. Acetic acid is the medicine. So another medicine we will talk, emaciation progressive everywhere and most marked in the lower extremities, what we have already discussed. Okay. Okay. So now we will talk about the headache. What type of headache we will find in case of Argentum nitricum? There is a congestive with fullness and heaviness, means heaviness feeling in the head, and congestion is there in the head. But something and the patient is feeling that it will expanding बड़ा हो रहा है फैल रहा है, the patient is thinking that. And especially we will find those who are a literary person, those who are working in the office, जो लोग ऑफिस में काम करते हैं उनमें ही ये मिलता है. ओके. एंड especially we will also find, and this is caused by while those person who are dancing, they will be having a headache from dancing. Okay, suppose if the patient is coming to you and that patient is explaining, नहीं डॉक्टर साहब मैं डांस करके आया हूँ फिर मुझे हेडेक हो रहा है, then we can think of this medicine. But if you're talking about the dancing, so can anyone tell me if there is a breathing problem which is getting relieved by dancing? सांस का प्रॉब्लम है लेकिन
CPR.
डांसिंग से आराम मिलता है, which medicine? Yes, CPR is the medicine. Very good. But if another patient is there, if the patient is listening the music, then he will start dancing. Which medicine? गाना सुनते ही नाचने लगा, चल छैया छैया
Tarantula.
छैया. Yes, the medicine is tarantula. Okay. And in this condition, you will find hemipnea. Okay. And and hemicrania pressure screen in the frontal eminence and temple, and ending in the bilious vomiting and aggravated from exhaustive mental labor and amelioration by pressure or tight bandaging. And that patient is getting relief by tight bandaging. But this tight bandaging we can also correlate if there is headache and which is getting relieved by tight bandaging. So can anyone tell me the more medicine और क्या medicine है जहाँ पे सर को टाइट बैंडेज करते तो आराम मिलता है, कोई बताएगा?
Belladonna.
Yes, belladonna is there and one more is there, that is manianthus. Manianthus is the medicine. Okay, where you will get. Okay. Another symptoms, crave sugar. Child is fond of it, but diarrhea result from eating. Okay, means the patient is eating sugar and that patient is liking too much sugar. If he will see sugar, so he will start eating. But once the patient will be eating sugar, so there will be a diarrhea. क्या होता है, शुगर खाना बहुत पसंद है लेकिन खाएगा तो उसे डायरिया हो जाएगा। सो वी कैन थिंक ऑफ दिस मेडिसिन। जैसे अगर क्लिनिक में या ओपीडी में पेशेंट आता है एंड द पेशेंट इज सेइंग दैट डॉक्टर साहब जब मैं चीनी खाता हूँ या ठंडा चीज कुछ भी खाता हूँ, चाय पी लिया तब भी हो गया, या मैंने खीर खा लिया, सो या कोई सिर्फ स्वीट खा लिया, सो मेरा पेट खराब हो जाता है। देन वी शुड थिंक कि अगर शुगर पसंद है एंड शुगर से डायरिया हो रहा है, देन वी कैन प्रिस्क्राइब दिस मेडिसिन। बट अनदर मेडिसिन इज देयर दैट पेशेंट loves salt and smoked meat. So can anyone tell me the name of medicine?
Calcarea.
Yes,
Calcarea fast.
Calcarea fos is the medicine. But what is the meaning of smoked meat? Smoked meat का मतलब क्या है? Can anyone tell? Smoked meat का मतलब क्या है? Can anyone tell? Smoked meat का मतलब होता है, सपोज जो लोग क्या करते हैं, अंगीठी पे सीख कबाब खाते हैं, ठीक है, जो फ्राई करते हैं, रोस्टेड करते हैं, ठीक है, दैट इज अ स्मोक्ड मीट। Yes, very good. Roasted meat, tandoori meat. Okay, we can say tandoori. Okay. So this is known as smoked meat. तो वो smoked meat किसको पसंद है ज्यादा? Calcaria fos is the medicine who likes too much salt and smoked meat. But if there is only craving for the salt, so which medicine?
Natramute.
Yes, natrum mure is there, and phosphorus is also there. Okay. Another symptom, flatulence dyspepsia, belching after every meal, stomach as if it would burst with wind, and belching, difficulty finally air rushes out with the great violence. Means flatulence dyspepsia is there, epigastrial pain is there, discomfort is there, को पेट में दर्द हो रहा है, लेकिन जब इरेक्टेशन आता है तो बहुत डिफिकल्टी के साथ आता है। Means this type of irritation you will able to hear. If there's a Argentum nitricum patient, then you can hear the irritation from the distance because there is a violent type of sound you will find and which is coming with very difficulty. Oh, you can hear if someone is there near in your home and you can see in the neighbor, most of the patient or most of the people, they are having loud eructation and which we can hear from the distance. And if we will we will able to hear from the distance, that we can understand अर्जेंटम नाइट्रिकम पेशेंट। अगर दूर से सुनाई दे रहा है किसी का इरिटेशन, if you can hear the irritation from the so much distance, then we can understand this is Argentum nitricum patient. But another patient is there. If the patient is having acidity and that patient is getting relief by irritation, then the medicine is, can anyone tell? अगर डकार आने से आराम मिलता है, कौन सी मेडिसिन है?
Carbohydrate.
Yes, carbobase is there. But if there is another patient who is having acidity and that patient is passing flatus, that gives relief to the patient. So which medicine is? Can anyone tell? Suppose this is abdomen. If the patient is passing eructation and that getting relief, the medicine is carbobase. Okay. But if the patient is passing flatus, एल फॉर लोअर, ओके, एल फॉर लोअर, अगर नीचे से हवा पास करता है तो एल फॉर लोअर, एल फॉर लाइको, ओके। बट इफ देयर इज अ distended abdomen in the center, okay, then the medicine is
China.
चाइना, ओके। सी को अगर पूरा बना दोगे तो गोला हो जाएगा, मीन्स डिस्टेंडेड abdomen, बट हाफ करोगे तो सी, सी फॉर चाइना। In case of China, there will be a no passing of eructation and there will be a no passing of flatus. ना तो हवा खुलता है, नहीं डकार आता है, that is China. Okay. Another symptom is that diarrhea as soon as he drinks. अगर पानी पीता है, so there will be a diarrhea. Okay. The patient is eating or drinking, it will causing diarrhea to the patient. So there is a medicine like Argentum metallicum is there. Argentum nitricum is there. Sorry. Argentum nitricum we are reading, and Gambogia is there. And Croton tea is also there. And Acalypha indica is there. But this we can correlate what type of diarrhea we will find in Croton tea. Here we can correlate with the Croton tea. अगर Croton tea का patient आएगा तो कैसे होगा? Suppose if the patient want to pass stool here, but that stool will go there, passing like shoot like passing like shoot मतलब बंदूक की गोली होती है ना जैसे निकलता है धड़ाक से निकला इतना दूर ओके patient want to pass here but that stool is going there that is crotontic it will come like jet like from the rectum but if there is a splattering diarrhea means patient want to pass the stool but एक ही बार में सारा निकल गया the patient passed the stool in one time that is known as spluttering diarrhea which is mentioned in the Acalypha indica okay गसिंग लिकोरिया इज डिफरेंट ओके गसिंग लिकोरिया का मतलब क्या होता है जो कि सीपिया में मेंशन है गसिंग लिकोरिया समवन सेड गसिंग लिकोरिया ओके स्प्लटरिंग डायरिया है तो हम लोग गसिंग से कोरिलेट कर सकते हैं किसी ने बोला है गसिंग लिकोरिया ओके सो गसिंग लिकोरिया का मतलब क्या होता है जैसे फ्लड आ जाना देयर इज प्रोफ्यूज लिकोरिया एंड द गर्ल्स अ फीमेल दे आर यूजिंग सो मच पैड as if the girl is having her menstrual period. This profuse leukorrhea is there. This large quantities of leukorrhea is there, white discharge. And that is known as gushing leukorrhea, which is mentioned in the sepia. Okay. Another symptom, urine passes unconsciously day and night. The patient doesn't know. Hello, am I audible to everyone? Hello, am I audible
Yes,
to everyone?
sir. Yes, sir.
Okay, fine. Okay. Okay, so suppose if the Argentum nitricum patient is there, that patient doesn't know, that patient unconsciously passing the urine at the bed, even in the daytime, even in the night. क्या होता है इसको ध्यान ही नहीं रहता है अर्जेंटम नाइट्रिकम पेशेंट को कॉस्टिकम पेशेंट को और सैनिकुला पेशेंट को they will pass the urine over the bed because they are not conscious okay So I was talking about the patient will pass the urine over the bed, and that patient doesn't know why because that patient is unconscious. Okay, he is not aware of about it. Okay, and let's talk about the another symptom: squassion, painful in both sexes, followed by bleeding from the vagina. Let's suppose if the male and female couple is there, okay, couple is there, and if they are going to perform a sexual intercourse. So that is very painful for the both sexes. And if they will perform, so there will be a passing of, I mean, there will be a bleeding while performing. Okay, so there will be a bleeding. While if the ladies or if the both couple is uh, performing sexual intercourse. So there will be a bleeding from the vagina. Then we can think of this medicine. But this we can correlate with the gynae and all. So can anyone tell me what we will say this? If there is a painful condition, a painful sexual intercourse, what we will say? Can anyone tell me the term? क्या कहते हैं इसे?
Dyspharia.
Yes, dyspareunia. Very good. Dyspareunia is the condition where there is, if the person is going to perform a sexual intercourse, so there will be a painful sexual intercourse. Okay. Another symptoms, great longing for fresh air. You can see in the picture. The patient is always craving for the fresh air, and like sulfur is there. And can anyone tell me more medicine for the fresh air? क्या क्या medicine है?
Pulsatilla, Calcarea
Pulsatilla, very
carb,
good, and
Calcarea carb.
calcarea carb and amyl nitrosum, etc. Okay, so these are the medicine for the fresh air. Another symptoms, great weakness of a lower extremities with trembling, cannot walk with closed eyes. Okay, a patient is having so much weakness, and that weakness will lead to the trembling of the legs. And if the patient will close the eyes, so there will be a difficulty to the patient while walking. आंख बंद करके चल ही नहीं पाएगा. And these symptoms we can correlate with the Romberg test. Okay, so just check it. What is Romberg test? Okay, क्लास के बाद में आप लोग चेक करना है Romberg test क्या है. And these symptoms also we can correlate with the illumina. And same symptom you will find in the illumina. Okay. Another symptoms, heat symptom often determine the choice of the remedy. Suppose if you want to prescribe the Argentum Nitricum, then we have to always look for the heat symptom, and which is generally we will find those people who are working in the office, and that headache is getting relieved by tight bandaging. So we will think of Argentum nitricum. Another symptom is their sensation as if part were expanding, and other error perception are the characteristic. The patient is always thinking that my parts are expanding. But these symptoms we can correlate with the another medicine. There is mentioned sensation as if growing larger in every direction. So can anyone tell me the name of medicine? कौन से medicine में होता है कि मैं बढ़ रही हूँ सारे तरफ? Hmm? Can anyone tell?
Platinum.
Yes, platina is the medicine. Very good. Platina. Very good. Platina is the medicine. Very good. Excellent. Another symptom, painful spot over the stomach that radiates to the all parts of the abdomen. You see, there is a pain especially in the epigastrium region, and that will radiate to the all direction. Okay, especially of the abdomen. Then we can think of this Argentum nitricum and annoying ulcerating pain and burning and constriction. Means there will be a burning of. I was talking about burning pain, and this burning pain we can correlate with the practice of medicine with a disease condition. So can anyone tell me where we can correlate? Can you tell me the name of disease condition? That is GERD, gastroesophageal reflux disease. Okay, we can correlate with the GERD. Okay, GERD, gastroesophageal reflux disease. Okay, and if another patient is there, if you're finding this type of symptom and this burning is relieved by drinking of warm water, so which medicine? Amelioration by warm water, drinking of warm water. So which medicine? Yes, very good, Amit. That is arsenic album. Arselv. Okay. Another symptom, gastralgia at beginning of the menses. Suppose if there will be a starting of her menstruation, at that time the patient is having problem which is related with the digestion. Okay, and another symptom is their suffocative cough as if from a hair in the throat. means the patient is unable to breathe. It's difficulty while breathing. सांस लेने में उससे कष्ट होता है, ऐसा लगता है कि गर्दन में कुछ फंसा हुआ है, नेक में कुछ फंसा हुआ है. Something is there in the throat. Okay. And another symptom is there, post-diphtheritic paralysis is there. Means suppose if the patient is coming to you and that patient was suffering from the diphtheria and after that the patient is having paralysis. पहले पेशेंट को डिप्थीरिया हुआ, उसके कुछ दिन बाद पैरालिसिस हो गया, देन वी कैन थिंक ऑफ दिस मेडिसिन. अनदर मेडिसिन इज देयर, डिप्थेरिनम. ओके. अनदर सिम्टम्स, sleepless from fancies before his imagination and horrible dreams of snakes and of a sexual gratification. Means there is a unable to sleep and there is a always fancies imagination, always he is imagining that I will go Mumbai and I will do like this and this, always imagining. क्या होता है, कल्पना करता रहता है दिस पेशेंट, ऑलवेज थिंकिंग दैट which is not in the range of patient. And this patient is always thinking about a sexual gratification. And there will be a dream, which is horrible dream of a snake, always having patient dream of snake. But can anyone tell me more medicine for the dream of snake? Can anyone tell? किस किस मेडिसिन में होता है?
Lecanemab.
Yes, very good. Lecanemab, very good. Akansha, very good. And lachesis is there, very good. So these are the three medicine for the dream of snake. That is lecanemab, Argentum nitricum, and lachesis is there. But what is the meaning of sexual gratification? Can anyone tell? Sexual gratification means the patient is getting pleasure while performing a sexual act. Okay, in short, we can simply say sexual pleasure. That is a sexual gratification. But if you're talking about the sexual gratification, so here we can correlate with the another medicine. Not medicine, we can correlate with the miasm. So can anyone tell me where we will find sexual gratification like symptoms? Under which miasm? That is Sora. ओके, सोरा के अंदर सेक्सुअल ग्रेटिफिकेशन लाइक यू विल गेट द सिम्टम्स. इचिंग होता है ना, तो इतना ज्यादा खुजली होता है दैट प्रोवाइड्स so much relief to the patient as if sexual gratification. So this is related with the sora, and this sora is also known as hydra headache. ओके, ये क्वेश्चन आता है, हाइड्रा हेडेट किसे कहते हैं, कौन सा मैजम को, हाइड्रा हेडेट. Okay, so hydra headed is Sora. Okay, just try to remember. Another symptoms we can this is the pneumonia. In short, we can remember this medicine. Okay, so let's talk about the Argentum. Okay, how we can remember Argentum nitricum. If for apprehension is always there, he will be having great anxiety while ready for anything. Okay, and this patient is very reserved and sad, and there is a great hasty means the patient who always want to do things in a fast and hurry way, बहुत जल्दीबाजी में होता है, that argentum nitricum patient. And this patient if for excitable and easily angered, गुस्सा भी बहुत आएगा, सर पे उसका गुस्सा होता है, if you will say anything he will provoke. Okay, and he will be getting anger so much. Okay, and for nervous and neglected is there, and this at T for the tendency to suicide, the patient is always thinking about the suicide. But this suicide we can also correlate with another medicine. If there is mentioned suicide by drowning, so which medicine? Suicide by drowning, which medicine? Antim crude is the medicine. Okay, antim crude is the medicine. anti-improved. Okay. And M for memory loss and U for undue fear of projecting buildings. Okay. So in short, we can remember by this mnemonic. Okay. Argentum, Nitricum. Okay. Another medicine we will read, that is Arnica montana. Okay, you can see this is a plant of Arnica montana. Okay. The picture. And this Arnica montana is commonly known as can invented. What is the common name of Arnica montana?
Leopard's bane.
Yes, very good. Leopard's bane, and another name is there. That is mountain tobacco. Okay. And Celtic hard. Okay. Celtic hard and Bruce wort and fall herb. These are the different common name of Arnica montana. And this medicine is proved by Dr. Hahnemann. And this medicine is prepared under class 3. Okay. So here generally whole plant is using for the preparation of medicine including root. Okay. So just try to remember. Sometimes there will be a question which part of the arnica is used for the preparation of medicine. Another question will be there, this medicine is prepared under which class? So answer will be class third. Okay. But prover कौन है? Who is the prover of this medicine? Then the medicine prover is Dr. Christian Frederick Samuel Hahnemann. And this is the common name we have to remember because कोई भी उठा के पूछ देगा mountain tobacco is the common name of which medicine? So answer will be Arnica montana. Okay. So let's talk about the symptoms. Nervous women, sanguine plethoric person, lively expression and very red face. You can see in the picture. Okay, very red face, sanguine plethoric. The lady or the person is nervous women, which they are very sad. But if sad patient is there, so there will be a rise of blood pressure and that will causing there will be a so much congestion over the face because of nervous patient is there, and you will find very red face like this is Arnica montana. Okay, but these symptoms we can also correlate with another medicine. One cheek pale, another is रेड सपोज एक पेल हो गया एक रेड हो गया सो कैन एनीवन टेल मी द नेम ऑफ मेडिसिन one chick red another pale and cold yes chamomilla is there very good chamomilla okay another symptom for the bad effects of resulting from the mechanical injuries suppose if any patient is coming to you and that patient got injured you can see in the picture knife is there okay knife is there, brick is there, and stick is there, hammer is there, and pin is there. Okay, if the patient is getting injury by the brick, by the stick, by the hammer, so we can think of arnica. Okay, but if there is an injury from the sharp cutting, so can anyone tell me the name of medicine? If sharp cutting injury is there, a sharp edge, no, that is calendula. Okay, calendula. But if there is an injury from the pin, कोई pin उठा के अंदर चुभा दिया, okay, then the medicine is ledum pal. Okay, so just try to remember. This is the basic difference. Okay, we have to remember. Okay, but if there is an injury to the nerves, then we can think of hypericum. Very good. Another symptom is there. Sore limb bruise feeling as if beaten. ऐसा लगता है कि डंडे से मार दिया हो. The patient is feeling that someone has beaten by the lathi and something hard, which is having a blunt surface. Then we can think of this medicine. And mechanical injury is there, and stupor and concussion and involuntary will be there. Involuntary answer in the midst of sleep. Okay, sometimes क्या होता है patient unconscious, and but he will be always giving the response. Okay, and you will also find there is a forehead cold and the nose is hot. Upper part of the body is heat and lower part of the body is cold. Means head hot and lower feet that is cold. We can say that is Arnica or Montana sign. If you're finding in any patient, then we can prescribe this medicine. Okay. Compound fracture. What is the meaning of compound fracture? You can see in the picture. Means where there is a torn of the skin or breaks of the skin and the bone will come out from the skin. Okay, this is known as compound fracture. And if the patient is having compound fracture with profuse suppuration, means pus formation is there, then we will think of Arnica montana. Okay. Another symptoms face hurt, face our heat and face alone hot and body cool. What I have already said. And this Arnica patient is saying nothing matter with him. The patient is having so much injury, but you will ask, क्या हुआ? क्यों ऐसे? Oh, किसी हुआ ही नहीं. Patient says, अरे कुछ नहीं हुआ यार. But the patient is having injury and the patient is having bleeding from that surface. But still the patient is saying there is no matter with him. हाथ कटा हुआ है, खून टपक रहा है. There is a discharge, bleeding from the injury area. But the patient is still saying there is no matter with him. Then again we can think of this medicine, Arnica. Okay. Another symptoms conjunctival or retinal hemorrhage with extravasation and injury or cough. Means suppose if the patient is coughing, so there will be a retinal hemorrhage. There will be a bleeding from the retina or congestion will be there. So again we can think of this medicine. Okay, another symptoms. Hydrocephalus deathly coldness in forearm of a children. Just finding this type of symptom, then we can think of Arnica montana. But if there is a deathly coldness of forearm children and there will be a diarrhea, then we can think of medicine bromium. Okay, in the bracket we will think of bromium. Okay. Another symptoms gout and rheumatism with great fear being touched or struck by person coming near him. Suppose those person who have already got injury in the leg and having so much pain. So क्या होता है किसी को चोट लगा है तो सामने से कोई आता है तो उसको लगता है अरे सामने से आ रहा है चोट लग जाएगा. And that patient is that pain will lead to the fear of being touched. ऐसा लगता है कोई टच न कर दे. Okay, so if you are finding this type of symptom, then we will think about Arnica montana. And cannot walk erect on account of bruised sort of feeling in pelvic region. Bruised feeling in the pelvic region, okay, especially in the pelvic region, and that's why the patient cannot walk erect. You can see the walk of the patient. Okay, and you will also find tendency to boil small boil one after another. Okay, एक ठीक होता है दूसरा आ जाता है. That is Arnica montana. But एक जगह अगर ग्रुप में होता है, so can anyone tell me the name of medicine? Small boils in the crops. Which medicine?
Sulfur.
Yes, very good. Sulfur is the medicine. Very good. A muscular tonic. This medicine is known as muscular tonic. If suppose if any patient got injury over the muscle, and that medicine will act like a tonic. Okay, so if any injury is there, first medicine we will think about the Arnica montana. And agoraphobia is there. Means you can see in the picture. Agoraphobia means fear of space. Okay, you can see in the picture. If you find a fear of space, then we can think of again this medicine. But these symptoms again we can correlate with another medicine. If there is a fear of closed places like train, bus, then the medicine is succinum. Okay, succinum. Another symptom, traumatism of grief, remorse, or sudden realization of a financial loss. Suppose if any patient is having business and unfortunately there is a problem in the business, there is a total loss of business, and that is also one type of a mental trauma. Then again we can think of this medicine. Okay. Another symptoms, feeling as if stomach were pressing against the spine and fetid vomiting is there and must lie down after every stool. This patient, if the patient is passing stool, after passing stool, the patient is always want to lie down. Okay. Another symptoms, violent spasmodic cough with facial herpes. Okay. If there is a herpes, facial herpes is there, okay, and associated with cough, then again we can think of Arnica montana. And if there is a acne indurata, which is appears symmetrically, दाएं दाएं गाल पे तो हो रहा है, बाएं गाल पे भी हो रहा है. If someone is having acne, especially on the left side of the cheek, then there will be again appear over the right side of the cheek. Okay, so finding both side of the cheek, then we can think of this medicine. Why? Because of symmetrical distribution. Then we can think of Arnica montana. Okay, and there is an involuntary stool during sleep. Why there will be involuntary? Because if the patient is got injury, so that injury will lead to the paralysis of the rectum. If there will be a paralysis of rectum, so the patient, there will be a two condition. One is unconscious, another is paralysis. If the patient is unconscious, in that condition, the patient can pass stool involuntarily. And if another condition is there, if paralytic condition is there, at that time also involuntary passing of stool is there. Patient doesn't know. Okay. Okay, thank you everyone. If there is any doubt, you can text me, you can message me.